Getting shots in the arms of low-income communities is often a question of access.
Now Central Health will pay certain providers to vaccinate high-risk patients. KXAN investigator Kevin Clark asked how these incentives could ultimately convince people to get a COVID-19 vaccine.
So I think if you can remove as many barriers.
Jill Ramirez has one main goal these days, getting the COVID-19 vaccine to the Central Texas Latino population.
We go to sleep thinking about the vaccine, get up thinking about the vaccine. We think as we're eating about the vaccine.
They compared vaccination rates.
Earlier this month, we told you researchers at UT found the Austin neighborhoods most at risk for COVID-19 infections are seeing the lowest vaccination rates. Most are east of 35 and have larger Latino and African American populations. And even as the shot becomes more accessible, vaccination rates are proportionally lower for these groups.
Sometimes you have the vaccine free, but you don't have transportation to get there.
To try and lower these barriers, Central Health is reimbursing certain vaccine providers for giving the shot. These include Community Care, People's Community, and Lone Star Circle of Care clinics. Providers will get $6 per shot for every one given dating back to March 1st. And the shot recipients must be Travis County residents earning at or below 200% of the federal poverty level, or these 20 zip codes with the highest rate of positive cases.
But if somebody moves 1,000 vaccines through a week, that's $6,000, and that's a significant contribution towards staffing levels, extra hours, or whatever it takes to connect people with the vaccine.
Providers would then use that extra money on transportation to and from appointments, helping people sign up, and educational campaigns. And for vaccine skeptics, Ramirez says this is putting money in the hands of the providers who these patients trust.
That you can probably use to go and develop some strategies to get more people to get the vaccine.
Kevin Clark, KXAN News.
Central Health is taxpayer funded. It's allocating $500,000 for the vaccine incentives.